Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about intergenerational trauma. In this video, we'll first look at what intergenerational trauma is. We'll then look at some risk factors and causes, symptoms, effects, treatment, and lastly, we'll finish off by looking at some coping strategies. What is intergenerational trauma? Intergenerational trauma, also known as transgenerational trauma or multi-generational trauma, is a trauma that is transmitted from a trauma survivor to their children. Trauma can be transmitted psychologically, environmentally, and socially. For Indigenous people in Canada, intergenerational trauma has been passed down to subsequent generations since the 19th century, when the Canadian government enacted policies to assimilate Indigenous people who were considered uncivilized and savages. A key mechanism the government used for assimilation was the residential school system, in which 150,000 Indigenous children attended. In residential schools, Indigenous children were taught to be ashamed of their languages and culture, and many were victims of mental, physical, and sexual abuse and neglect. As a result, residential school survivors suffered various mental and physical health problems in comparison to Indigenous adults who did not attend. What remained for many residential school survivors was pain and the inability to take on healing practices. Evidence suggests that children of residential school survivors have a higher risk for poor well-being. Many residential school survivors had passed on the abuse they had experienced to their own children. Risk factors. Other than the generational transmission of trauma, intergenerational trauma can also occur due to oppression, such as racial trauma or other systemic oppressions. Intergenerational trauma effects can also occur in descendants of residential schools, refugees, and Holocaust survivors. Several situations can cause intergenerational trauma, including colonization, enslavement, genocide, cultural genocide, forced migration, family separation, war, famine, and natural disasters, being a member of a cult, global or national crises, death, experiencing or witnessing violence, abuse, or neglect, systemic racism, discrimination, oppression, and poverty. Symptoms. People who experience intergenerational trauma might experience symptoms from previous generations. These symptoms might be similar to those of post-traumatic stress disorder, such as hypervigilance, anxiety, and mood dysregulation. Other symptoms can include dissociation and depersonalization, emotional numbness, difficulty forming social connections and creating trust, isolation and withdrawal, shame, guilt, grief, low self-esteem, feelings of helplessness, avoidance of certain places, people, or things, nightmares, intrusive thoughts, decreased sense of security, depression, anger, and suicidal ideation. Physical symptoms can include headaches or migraines, stomach aches, shakiness, and hot body temperatures. Effects. Intergenerational trauma can affect relationships with family and partners, one's personal identity, communication, and parenting styles. In the long term, intergenerational trauma can lead to depression, higher rates of heart disease, stroke, substance use, impaired cultural identity, higher rates of suicide, and early death. Treatment. Trauma-informed interventions or therapy can help people manage symptoms, learn the impacts of intergenerational trauma, as well as the tools to transform embedded patterns and heal. A type of therapy includes narrative exposure therapy, which is executed in a group setting to help people manage complex trauma. Narrative exposure therapy helps people reframe and contextualize the experience and diminish the effects the trauma has on them. Another type of therapy is trauma-focused cognitive behavioral therapy, which uses psychoeducation and cognitive techniques to educate children and adolescents on the ways they can express themselves, discover cognitive coping skills to manage stressors, learn relaxation techniques, process their narratives about their trauma, and manage harmful behaviors. Coping strategies. A method to cope with intergenerational trauma is to reconnect with cultural knowledge and wisdoms. One can engage with their culture through song, dance, storytelling, art, writing, religion, and healing circles. People can also build resilience by gaining support from loved ones, friends, community, or support groups, and taking care of oneself. They can also seek help from a professional. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forsaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.